The words hit Jennifer Morrison like a physical blow, leaving her gasping in the sterile silence of Dr. Marcus Webb's office. "I'm sorry to tell you this, but Sarah has stage 4 acute lymphoblastic leukemia. Based on the progression we're seeing, she has approximately 6 months to live." 9-year-old Sarah sat between her parents, swinging her legs from the examination table, completely unaware that her world had just been shattered. She looked perfectly healthy, bright eyes, rosy cheeks, the same endless energy that had been driving her parents to exhaustion since she learned to walk. But the medical chart spread across Dr. Webb's desk told a different story, filled with lab results and imaging reports that painted a picture of aggressive cancer ravaging her small body. Michael Morrison gripped his wife's hand so tightly his knuckles went white. "Are you certain? She seems so healthy. How is this possible?" Dr. Webb, a distinguished oncologist with 20 years of experience at Children's Memorial Hospital, nodded gravely. "Unfortunately, pediatric leukemia can progress very rapidly, often with minimal symptoms until the advanced stages. Sarah's blood work shows severely compromised white cell counts, and the bone marrow biopsy confirms widespread malignancy." But in the corner of the examination room, Healer, the hospital's German Shepherd therapy dog, was exhibiting behavior that would have alarmed anyone trained in canine stress signals. The dog's ears were pinned back against his head, his tail tucked low, and his entire body radiated confusion and distress. Most concerning of all, Healer refused to approach Sarah, something he had never done with any sick child in his 3 years of hospital service. Jennifer's voice broke as she asked the question every parent dreads. "What are options? What can we do?" Dr. Webb leaned forward, his expression appropriately somber. "We'll begin aggressive chemotherapy immediately. I won't lie to you, it will be difficult, and given the advanced stage, the prognosis remains guarded. But we'll do everything possible to buy Sarah more time and make her as comfortable as we can." The Morrison family left the hospital that day carrying a death sentence that would consume their lives for the next 4 months. But they had no way of knowing that Sarah's diagnosis was entirely fabricated, part of an elaborate insurance fraud scheme that Dr. Webb had been perfecting for over 2 years. The lab results were falsified, the imaging reports were from other patients, and every piece of evidence supporting supposed cancer was a carefully constructed lie designed to generate hundreds of thousands of dollars in fraudulent medical billing. Healer, however, knew the truth in ways that human medicine could never detect. The German Shepherd's extraordinary sense of smell could identify the chemical signatures of various diseases, including the distinct metabolic changes that accompany cancer. Sarah smelled completely healthy to him, no trace of the cellular breakdown, inflammatory markers, or medication effects that characterize truly ill children. Healer's distressed behavior wasn't sadness over Sarah's condition. It was confusion over the humans, inexplicable insistence that a healthy child was dying. The first chemotherapy session took place the following week in the hospital's pediatric oncology unit. Sarah, still blissfully unaware of her supposed diagnosis, chatted excitedly with the nurses while the 4 was prepared. Her parents sat on either side of her bed, their faces showing the hollow exhaustion of people who had spent sleepless nights researching childhood leukemia and planning for their daughter's death. "Will this make me feel better?" Sarah asked as the medication began flowing into her arm. "Yes, sweetheart," Jennifer lied, choking back tears. "The doctors are doing everything they can to help you." But the chemotherapy drugs weren't treating cancer, they were attacking a healthy child's immune system, deliberately making her sick to maintain the illusion of illness. Dr. Webb had calculated the dosages carefully, enough to produce visible symptoms that would convince the family and insurance companies that aggressive treatment was necessary, but not enough to cause permanent damage that might prompt outside medical consultation. Healer was present during many of these sessions, and his behavior became increasingly agitated as the weeks progressed. The German Shepherd would pace restlessly around Sarah's bed, whining softly and occasionally pawing at the 4 lines as if trying to remove them. The medical staff attributed his distress to sensing Sarah's deteriorating condition, not realizing that Healer was actually trying to protect her from treatment that was making her sick. By the 3rd week of chemotherapy, Sarah had developed the classic symptoms of cancer treatment: nausea, fatigue, hair loss, and weight loss. to her parents and the insurance investigators who periodically reviewed her case. These changes confirmed the accuracy of her diagnosis and the necessity of continued treatment. Dr. Webb documented every symptom meticulously, building a paper trail that supported his fraudulent billing claims. "She's responding as expected," Dr. Webb told the Morrisons during a follow-up appointment. "The treatment is working, but we need to increase the intensity to stay ahead of the cancer's progression." Jennifer looked at her daughter's pale, thinning face and felt a mixture of hope and terror. "Is she in pain?" "She tries to be brave, but I can tell she's struggling." "Unfortunately, aggressive treatment comes with significant side effects," Dr. Webb replied smoothly. "But every day we can extend her life is precious. I recommend we proceed with the enhanced protocol." The enhanced protocol involved higher doses of chemotherapy drugs that would make Sarah sicker while generating even larger insurance payouts. Dr. Webb had performed this same scheme with 7 other children over the past 2 years, each time selecting families with excellent insurance coverage and limited medical knowledge. None of the previous victims had been discovered, and he saw no reason why Sarah's case would be any different. But Healer's behavior was attracting attention from unexpected sources. Dr. Amanda Chen, a veterinarian who consulted on the therapy dog program, had been asked to evaluate Healer's unusual stress responses around certain patients. During her observation sessions, she noticed something that struck her as odd. Healer's distress seemed inversely related to the patient's actual condition. "He's most agitated around the children who appear to be responding well to treatment," Dr. Chen noted in her report. "It's almost as if he's reacting to something the medical staff isn't seeing." Her concerns reached Dr. Lisa Rodriguez, the hospital's chief of pediatric oncology, who had been reviewing some irregularities in Dr. Webb's patient outcomes. Several of his cases showed unusual patterns: rapid diagnosis followed by immediate aggressive treatment, limited second opinions, and insurance claims that seemed disproportionately high compared to other oncologists. "I'd like to review the Morrison case," Dr. Rodriguez told Dr. Webb during their monthly department meeting. "The progression timeline seems accelerated, and I want to ensure we're providing optimal care." Dr. Webb's expression remained professionally neutral, but internally he felt the first flutter of concern. "Of course. Sarah is a challenging case, but I believe we're making progress. The family has been very cooperative with the treatment plan." Dr. Rodriguez's review of Sarah's file revealed inconsistencies that raised immediate red flags. The initial lab work had been processed through an outside laboratory that Dr. Webb frequently used, rather than the hospital's accredited facility. The bone marrow biopsy slides were missing several standard markers, and the imaging reports lacked the detailed annotations typically required for pediatric cases. "I'd like to order confirmatory testing," Dr. Rodriguez told the Morrison family during an unexpected consultation. "Sometimes we get inconclusive results, and I want to make sure we have the most accurate picture of Sarah's condition." Michael Morrison felt a surge of hope mixed with terror. "Are you saying there might be a mistake in her diagnosis?" "I'm saying that medicine is never 100% certain, and getting a second set of data points is always good practice," Dr. Rodriguez replied carefully. "We'll have the results within 48 hours. During those 48 hours, Healer's behavior around Sarah changed dramatically. The German Shepherd seemed to sense that something significant was about to happen, and his agitation transformed into protective vigilance. He positioned himself between Sarah and Dr. Webb whenever the oncologist visited, his hackles rising slightly and his gaze never leaving the doctor's face. The new test results arrived on a Friday afternoon that would change everything. Dr. Rodriguez stared at the lab reports in disbelief, reading them 3 times before calling the Morrison family. Sarah's blood work was completely normal. Her white cell counts were within perfect healthy ranges. Her bone marrow showed no signs of malignancy, and every cancer marker came back negative. "Mrs. Morrison, I need you and your husband to come to the hospital immediately, Doctor," Rodriguez said, her voice tight with controlled emotion. "Bring Sarah, but don't mention anything to Dr. Webb. This is extremely important." The meeting took place in Dr. Rodriguez's office, with Healer present at Jennifer's request. The German Shepherd immediately relaxed when the family entered, his tail wagging for the first time in months as he approached Sarah with normal, healthy enthusiasm. "Sarah doesn't have cancer," Dr. Rodriguez said without preamble. "She never had cancer." Every test we've run indicates a completely healthy child. The original diagnosis was based on falsified lab results. The silence that followed was deafening. Jennifer stared at Dr. Rodriguez as if she were speaking a foreign language, while Michael's face cycled through confusion, hope, and growing anger. "That's impossible," Jennifer whispered. "She's been receiving chemotherapy for months. She's lost her hair. She's been sick. How can she not have cancer?" Dr. Rodriguez's expression was grim as she delivered the devastating truth. The chemotherapy was making her sick. Sarah's symptoms weren't from cancer, they were from unnecessary treatment that was slowly poisoning her healthy body. The investigation that followed revealed the full scope of Dr. Webb's fraud. FBI agents specializing in healthcare crimes discovered that he had been systematically diagnosing healthy children with terminal illnesses, then subjecting them to harmful treatments while billing insurance companies for hundreds of thousands of dollars. His scheme had victimized 12 families over 3 years, generating over $2.3 million in fraudulent claims. Dr. Webb was arrested at his home as he prepared to leave the country with money transferred to offshore accounts. During his interrogation, he showed no remorse for the children he had poisoned or the families he had tortured with false death sentences. "It was a perfect system," he told investigators coldly. "Parents never question a cancer diagnosis. Insurance companies pay without hesitation for pediatric oncology. And the symptoms from unnecessary treatment actually supported the fake diagnosis." Sarah's recovery was swift once the chemotherapy was discontinued. Her hair grew back, her energy returned, and within 2 months, she was back to her normal, vibrant self. But the psychological recovery for the entire family took much longer. The trauma of believing their child was dying, combined with the betrayal of trusted medical authority, required extensive counseling. "We gave up everything," Jennifer told reporters during Dr. Webb's trial. "Michael quit his job to stay home with Sarah. We sold our house to pay for treatments insurance didn't cover. We were planning her funeral while he was deliberately making her sick for money." Healer received recognition from both the FBI and the American Medical Association for his role in exposing the fraud. His instinctive recognition that Sarah was healthy, when every human authority insisted she was dying, had provided the first clue that something was fundamentally wrong with her case. Dr. Chen, the veterinarian who had initially documented Healer's unusual behavior, spoke at medical conferences about the incident. "Animals don't lie," she explained to audiences of healthcare professionals. "They can't be fooled by false documentation or convinced to ignore their senses." Healer knew Sarah was healthy because she smelled healthy, looked healthy, and acted healthy. He was trying to tell us that our medical conclusion didn't match biological reality. The hospital implemented new protocols requiring independent confirmation of all terminal diagnoses in pediatric patients, with mandatory involvement of multiple specialists and outside laboratory verification. Healer's behavioral patterns around patients became part of an informal early warning system that helped identify cases requiring additional scrutiny. Sarah Morrison, now a healthy teenager, often visits Healer at the hospital where she was once a patient. The German Shepherd's tail still wags enthusiastically when he sees her, recognizing the child he helped save from a medical system that had been corrupted by greed. "He knew I wasn't sick when everyone else said I was dying," Sarah told a documentary crew filming a story about medical fraud. "If not for Healer, I might have died from treatments for a disease I never had." Dr. Webb was sentenced to 25 years in federal prison and ordered to pay full restitution to his victims. During his sentencing hearing, the judge noted that his crimes represented one of the most callous forms of abuse imaginable, deliberately harming children while exploiting parents' love and trust. The Morrison family used their settlement money to establish a foundation funding independent patient advocacy services for families facing serious pediatric diagnoses. They also sponsored Healer's continued work as a therapy dog, understanding that his ability to detect truth when humans had been deceived could save other families from similar nightmares. "Medical professionals can be wrong," Michael Morrison said during a conference on healthcare fraud prevention. "Technology can be manipulated. Documents can be falsified. But our dog's nose and instincts couldn't be fooled. He saw through a lie that cost us months of agony and nearly killed our daughter." Healer continued his work at Children's Memorial Hospital, where his presence provided both emotional support for genuinely ill patients and an additional layer of protection against future fraud. His story became a reminder that sometimes the most sophisticated medical systems can be corrupted, while the ancient partnership between humans and animals offers protection that no amount of technology can replicate. The German Shepherd had proven that truth has a scent that cannot be faked, and love has an instinct that cannot be deceived. In a world where trust and authority can be exploited for profit, Healer represented the irreplaceable value of natural honesty in its purest form.